Children's Hospital Los Angeles is one of two centers on the West Coast that treat eye cancer in infants and toddlers from all over North America. Dr. A-Linn-Murphree discusses this rare form of cancer.
There's a cancer that arises in the eye in children. It's fairly rare. There are about 300 cases in all of North America a year. But it affects children from birth to 3 years of age. And it's called retinoblastoma. It arises in the retinoblasts, which give rise to the retina itself. And after 3.5, there are no more of those, so we can't see the tumor arising after that. But it is pretty devastating for a young family to find their 8-month-old or their 12-month-old suddenly is diagnosed because they have a white glow in the eye. And a member of the family or someone in the extended family sees a cat's eye reflex or a white glow or a glint or a gleam. And usually when the lights go down and the pupil dilates naturally, so it's usually late in the day. And so we come in and it turns out to be this particular cancer that can affect both eyes. Fortunately, more than half the time it's just one eye. But the treatment is like any other childhood cancer. It involves surgery, which is removal of an eye. So most kids who have this tumor have at least one eye removed. The others are treated with chemotherapy. So it's just like any other cancer. They get 6 months of 3 drugs, get really sick. And then we have to treat with laser and other kinds of treatments after we reduce the volume of the tumor with chemotherapy. The earlier we can see these kids, the better chance we have of saving both vision and the eye. And so for 15 years, we here at Children's have been really interested in teaching pediatricians, even though it's rare, even though they only see 1 or 2 cases for 30 years, they really need to know how to examine the well baby, every child at 1 month, 2 months, 3 months of age, to test for it, to look for it. And it's a fairly simple test. We're also working on ways to improve the treatment. We really, most of the kids present with fairly advanced disease in the eye, and once we see them, even today, we can save only about 1 in 4 eyes that has advanced disease. And so we're looking for better ways to treat. Most people treat with giving drugs in the vein, but I mean, the eye is a tiny part of the body, so if we had a way to give chemotherapy directly to the eye, it would be much simpler, wouldn't have the side effects. So those are some of the things that we are specifically working on to improve treatment. It's the only center in Southern California that treats this disease, and so virtually all the retinal surgeons, most of the pediatricians, and certainly the ophthalmologists know that if they even think they have a kid who could have this, this is where they go.